Yeah, just a quick review of the Crucial Compression Knee Sleeve. So this sleeve is specifically made for people that are having knee pain or have some type of knee problem. The idea here is that, you put on the sleeve, supports the joint, the surrounding soft tissues, might restrict the motion a little bit. And so that way your knee has a chance to kind of rest, recover, and doesn't get so stressed out as you're doing various activities. So a few points about this particular brace. It is made of a highly breathable material, which is good, because if you wear it a lot, or even if you're wearing it, like for some like sporting activity or something, you're going to get you're going to start sweating, and then of course the sleeve starts picking up the sweat, and then after a while it smells, and then you got to start washing it more frequently. So it's always best just to start with a highly breathable fabric first. And the other thing is this is a pretty stretchy sleeve. It's actually stretchy enough that if you have your shoe on, you can just slip this thing on over your shoe. So it'll stretch over your shoe. That way you don't have to take your shoe on and off, because something that's kind of a pain in the butt. So anyway, yeah, other things you can do for your knee besides a knee sleeve. As an example, getting this from Bulletproof Your Knee book. If you're having any kind of knee trouble, make certain that you're strengthening your quads. Your quads is a big muscle on the top of your leg. It's the main stabilizer of your knee joint, so it has to be really strong. The thing is, they're finding for a lot of different knee problems, if you have this problem, like say, you tore your ACL, or, your posterior collateral ligament and so on, you'll probably have a problem with your quadriceps as well. So this whole chapter is actually dedicated to knee problems that, when researchers look at, people with these particular problems, they also find they have problems with the quads. I mean, it's usually not strong enough as it should be, or if they look at cross-sectional area on CT scans, they find it's actually smaller than normal. So these are various problems, like having knee swelling in your knee can take its toll on your quadriceps. Interestingly, here it says, even if you have as little as 20 millimeters of fluid in your knee, which is just over a tablespoon, it's enough to decrease the strength of your quad muscle. I thought that was interesting. So if you have any knee swelling, it can take its toll on how strong your quadriceps muscle is. Knee injuries in the quadriceps, if you had, any kind of like a fractured tibia, any surgical opening of the knee joint, you've had surgery on your knee, probably have a problem with your quads not being strong enough. Ligament problems, like I said, ACL, anterior cruciate ligament, posterior cruciate ligament, if you've torn it before, then you probably have some quad weakness. Medial collateral ligament, studies done on that. Knee pain, having knee pain can affect your quad muscle, so that's not as strong enough. Here's an interesting one, knee arthritis and the quadricep. So there's actually a lot of studies on this showing that if you keep your quads strong, if you have knee arthritis, okay, they know that you probably have quadriceps weakness. There's actually randomized controlled trials showing that if you strengthen the knee, just the quadriceps muscle, the arthritis pain gets a whole lot less. And the other thing is, if you have stronger quads, they've actually shown that you have less progression of your knee arthritis. So it actually can prevent, future joint deterioration. Really important. Patellofemoral pain syndrome. I mean, the list just goes on and on. Definitely make sure that you do some quad exercises and get that really strong. Let's see, fine control over your knee. Here they're mainly talking about hip muscles. Sometimes you can have a hip problem, a hip muscle problem, and it affects your knee. So the problem necessarily might not be at the knee itself, anything wrong there, but something wrong with the hip. So the classic examples like iliotibial band syndrome. When you take groups of people with iliotibial band syndrome and you strength test their muscles, they find in particular they have weakness with their hip abductors. So abduction is what brings your leg out to the side. Likewise, they take groups of people with iliotibial band syndrome and they strengthen their hip abductors. Guess what? The knee pain goes away. They don't have iliotibial band syndrome anymore. So that's real interesting stuff. So just some other area you might want to cover if you've had chronic knee pain. Optimize knee flexibility. Of course, you want to make sure that your knee bends and straightens. But your knee doesn't just bend and straighten. Well, actually, about the last 15 degrees of extension, of you straightening your leg, it actually rotates laterally. And here's a little test to see if you have that accessory motion. So your knee actually does have a little bit of rotation there at the end range, which is an accessory motion you need to have a fully functional knee. Other things you can do, increasing dynamic knee stability. Here they're talking about your proprioception. So if I suddenly turn the lights out now, you'd be able to tell whether your knee is bent or straight, and that's because your proprioception. Okay, you have little joint receptors, in the joint, the soft tissues. They give you constant feedback into your brain as to where your knee is. They find when people are having knee problems, they have decreased proprioception. It's just not really what it should be, but there's actually exercise you can do to get that back. So other stuff you can do. But yeah, nothing's as quick as putting on a knee sleeve. Gives you that kind of instant relief and support. So yeah, it's a good one. Check it out.